Hi guys, Yolanda here from Vent Company, your ventilation specialist, and today we're going to review calibrating the oxygen cell on the Louisa ventilator from Loewenstein Medical. Our oxygen cell has already been inserted into this machine. If you need any more information with regards to insertion, you can refer to the basic instructions for use manual that comes with the ventilator. The oxygen cell has to be calibrated after insertion and then every 6 weeks. The oxygen cell can be calibrated while being connected to a patient, but the oxygen has to be disconnected. So if your machine is connected to a patient and you want to calibrate the oxygen cell, disconnect the oxygen. Please put your patient on some other monitoring device like saturation, and observe your patient for any signs and symptoms of distress, and make sure that you do the calibration and connect the oxygen afterwards. So if we want to calibrate the cell, we will do as follows. You can go to System. In System you will see there is FiO2 cell, and it says active because we activated it after insertion. Just below it you will see Calibrate. I'm going to press the Calibrate button. The screen will tell you remove O2 supply. Our oxygen is disconnected at this moment, so the machine is on room air as you saw on the first screen. And then you will press OK to start the calibration. Once the calibration has been completed, you'll see a message displaying calibration of FiO2 cell complete, reconnect oxygen supply. So you can connect your oxygen and you can go on treating your patient with oxygen. And then we press finish and our calibration is complete. That was a review of the oxygen cell calibration on the Louisa ventilator from Loewenstein Medical. Thanks for watching, and I see you soon.